We've known for a long time that the bisphosphonates clearly reduce the risk of skeletal-related events in patients with metastatic disease, so that's clearly improved the outcome of those patients. But the bigger issue that's been circulating for the last couple of years is does it reduce the risk of developing metastatic disease? In other words, does it add to reducing metastatic disease, improve the overall outcome of patients with early stage disease? And we've actually had a series of conflicting data from numerous trials over the last decade, some suggesting improvement, some sort of a wash, not showing anything. And at this meeting, we again had a cluster of trials, including updates of the Azure trial, ZOFAST trial, B34 from the NSABP, and the GAIN trial. And again, it was a mixture of results. The Azure trial, again, suggesting overall that patients who were premenopausal, who got an endocrine therapy alone treatment, number one, had an exceedingly good survival now with 7 years of follow-up. But they also looked at whether the addition of the bisphosphonate improved outcome. And it does appear that with longer-term follow-up that finding is still present. Whereas the GAIN trial, which looked at a different agent, a different bisphosphonate, showed no benefit. So we still have somewhat conflicting data on whether bisphosphonates add anything in this setting, but I think there's probably a thread running through the recent trials that there's something there. They probably do, in some respect, reduce the risk of recurrence, because what we're seeing is not only a reduction in recurrences in bone, where you might intuitively think they'll have their effect, but also in other organs as well. So I don't know that it's going to overnight change practice, but I think it's still something that is on people's minds. And based on these data, again, once we see them published, it may influence the use of bisphosphonates in the adjuvant setting. The interesting thing is what seems to be the case in all these trials is the bisphosphonates seem to have their effect in an estrogen deprived environment. So in other words, older women in that setting where there isn't much estrogen around. So the effect seems to be greatest in older patients. And that's in every, well, I shouldn't say in every trial, but in most trials where that subset has been analyzed, that seems to be an effect that's consistent across recent trials. Whether we have a trial that hasn't been reported yet that's going to be definitive in answering this question, I'm not sure. I think there's still a lot of debate about how much this effect is real versus just something that's sort of a subset analysis of a certain group of patients. So I don't know that we'll have a definitive answer anytime soon.